Good evening. Tonight I'm going to talk to you about my professional interview presentation and the nurses I decided to interview. My interviewees were two registered nurses. I chose them because I plan to continue my education after I graduate to go on and obtain my Bachelor of Science in Nursing. Both of the interviews were done in different ways. I had one I interviewed in person and one was interviewed over the phone. The first nurse, registered nurse, she's a Bachelor of Science in Nursing. She decided to become a nurse when she was a little girl after she was in a car accident and was in the hospital for 6 weeks. She really admired the nurses that were taking care of her, and she decided at that point that she wanted to become a nurse and give back some of that care she received. So her nursing career started right out of high school, where she got her certified nursing assistant certification, and she did that for a while and then decided to advance a little bit and went ahead and got her licensed practical nurse licensure. Did that for a few years and then decided she wanted to become an RN, so she went to nursing school to get her associate's degree in nursing. Did that for a few years and then decided to get her bachelor's degree. So all in all, she's been an RN for over 31 years. Her current title, she's the Director of Inpatient Services for Multi-Specialty Units. She was hired to this position after attaining her Bachelor in Science degree, and also with her overall experience working as a labor and delivery nurse, working in the emergency department, working in patient surgical units, she was pretty well qualified for the job. For the interview process, she was interviewed over the telephone and she did a panel interview before she was finally offered the job formally. So she went through a day in her life as a director, and she said her day starts at 6:30 a.m. She starts with emails from her nursing supervisors just letting her know about their staffing and patient census for the day. Once she finally goes into work, she has to go to a bed meeting, which is a multi-specialty meeting that brings together all the nursing supervisors from each inpatient unit. So all the nurses come together and they also work with social workers, physical therapists, utilization management, case management, and a hospitalist is there as well. And they basically discuss each patient that is admitted to the hospital. They talk about when they can be discharged, what services they're going to need after they're discharged, rehabilitation, nursing home, hospice care, and that's where case management, utilization management, that's where those, and social workers, that's where they come into play. So it's a very team-oriented effort for each patient. After that bed meeting, she goes on with the rest of her day to other various meetings, and that can include meetings with drug reps, meetings with equipment representatives, meetings with her other nursing supervisors to talk about staffing issues, patient issues. Sometimes she meets with patients and patients' family members if they have complaints or any issues. She helps them with that. She also is in charge of payroll. She's in charge of employee interviews, employee evaluations. She has to justify staffing needs so that she can hire more nurses. So she is in charge of quite a few different things and goes about her day and does a lot of different things throughout the day. So I asked her about some of the best and worst parts of her job. Two of the things that she pointed out with her favorite part of the job is that it's never the same. Each day is something different. Each day she's doing something different, talking to somebody different, different meetings, learning something different, and that's one of the things she really enjoys about her job. One of her least favorite parts of the job is all the paperwork that has to be accomplished every day. Between state regulations, hospital regulations, each patient has a lot of paperwork that has to be accomplished to make sure that everything is taken care of, and it can be very tedious and very difficult. While the paperwork is a good thing, again, the application of it can be really hard. So those were the only two things, the only thing really that she said that was the worst part of her job. So that's not too bad. One of the things that I wanted to gain from these interviews because her and my other interview, the other nurse I interviewed, have been in nursing for so long, I wanted to know how they feel nursing has changed. And one of the things she said is she feels that nursing has, the RN's focus has shifted from patient care to paperwork. Because, like I said earlier, there's so many regulations, there's so many between the state and the hospital, that the RN spends most of her time doing paperwork instead of doing actual hands-on patient care. And that's one of the things that she missed when she went into, after years of being in nursing, is she noticed that more and more RNs were sitting at desks doing paperwork than in the room talking with their patients, helping their patients, working with family members. That's more now shifted to the certified nursing assistants and the licensed practical nurses instead of the actual RN. And new RNs that are coming into the field, she feels aren't getting to experience that hands-on patient care as much as they used to. So I asked her for some advice, for somebody that's going into nursing school. She's been doing this for a while. And a few things that she said to me are study hard, learn as much as you can. And the biggest thing that she pointed out is know what you don't know. She said arrogance is one of the worst things in nursing, because when you are arrogant and you think you know everything, that's when you can make mistakes. And don't be afraid to ask for help. If you don't know something, then ask. And that's the best way to learn, because nursing is a constant learning experience. And never bluff your way through anything. This is a big thing. She said, if you don't know it, it's going to come out eventually, and that's when people start to get hurt. And her encouragement for becoming a nurse is that nursing is always a good choice because your career can go in so many different directions. You're not stuck in one place, one job all the time. You can go into patient care, inpatient care, outpatient care, education, utilization management, case management. So there's so many different areas of nursing that you don't always have to do the same thing. And there's always room for growth. You're always learning something new, so it's not stagnant when it comes to learning and opportunities to grow, like some job fields can be. Next registered nurse I interviewed, she had the same career path as the other nurse. She started her career as a licensed practical nurse, and she originally started it as a stepping stone to medical school. But after she started working for a while, she realized, I really like this hands-on patient care. I like being in the room, taking care of the patient, and you don't get to do that as much when you're a medical doctor. So she decided to stay in nursing. So she advanced her career and went on first to get her associate's degree, did that for a while, and then went on and got her bachelor's degree in nursing. So all in all, she's been in the nursing field for over 41 years, and most of that was spent working in the neonatal intensive care unit. She started out as a floor nurse and then went on to be the head of the NICU. She's also a certified breastfeeding consultant. And while she was working in the NICU, she was offered the job at the Army Public Health Clinic. So she decided, I'll try outpatient care for a while. So she made a lateral transfer from inpatient care to outpatient care. Now that she's working in Army Public Health Nursing, she's currently in charge of the Sexually Transmitted Infections Program. And what she does with that is she works on surveillance of sexually transmitted infections. She counsels patients who have STIs. She educates them about how they could have gotten the disease and how they can avoid getting it in the future. She's also working to bring down the number of cases through education. So she's going and doing briefings, educational briefings about STIs to new incoming soldiers and trying to get them before they are to get an infection. She's also in charge of the Pregnancy Physical Fitness Program for active duty female soldiers. So women who are pregnant or postpartum, they go to these classes, and she gives different classes every week. Classes on breastfeeding, classes on eating healthy, classes on exercise, classes on postpartum depression, and letting these women know what resources they have available to them, and so that they are better educated about what they have available as far as services and how to better get themselves back into shape to go back into work. So again, I asked her what her opinion was on how the nursing field has changed, and she had the same opinion that nursing, for registered nurses, the focus has shifted from patient care to taking care of paperwork, and that the responsibility of patient care is going to certified nursing assistants and LVNs. Her other issue is that more and more colleges are offering fast track RN programs. This allows students to become nurses who have no patient care background. So essentially, people are enrolling in these programs if they have a prior bachelor's degree, but their prior bachelor's degree could be in engineering or biochemistry and not actually a degree in patient care. And she feels that RNs coming out of these programs that have no foundation in patient care they lose that critical thinking skill that you get when you have a strong background in patient care. And she feels like it's a shortcut or cutting corners, and it can be pretty dangerous for the nursing profession. Some of the professional organizations she belongs to: American Nursing Association. She's also has her certification in holistic nursing. She's involved with Links Incorporated, which is a community service organization, so she does a lot of community service outreach work. She also is a member of the NAACP, and with this she's been able to go into the women's prisons and work with the women prison population, which she says has been very rewarding, to go in and do work with them with education, awareness, and things like that, and she's really enjoyed that work. And she's also a member of the Hawaii Public Health Association. So that's it. Both of these women have a lot of experience, and I was able to get from them some really good words of wisdom and just kind of get an idea of what it's going to be like to become an RN. And they are both very valuable members of the nursing profession, I believe, and I'm very glad I was able to interview them both.